thank you for coming in for your consultation and the starting of your facial reconstruction surgery. I'm just going to take a couple of moments to go through some of your requests and to give you the best advice that I know how regarding the next couple of steps to take. Now, according to your charts, it looks like you would like to have some moles removed, freckles, things that you might be concerned with, not just for cosmetic reasons, but for also making sure that there's nothing problematic that you need to pay attention to. Do you normally tan? Do you have any skin routines that you're concerned with that might be contributing? Okay. Well, if it's okay with you, I'd like to take a very close look at your skin and see whether or not there's any abnormalities on the surface before we begin making some marks about different areas. Okay. Just gonna wash my hands here real quick. Do you have any makeup or anything like that currently on your skin? Sunscreen? That's good. Okay. And now it looks like the areas that you were probably most concerned with are like right here on your nose. Okay. Now when I touch them, I apply pressure. Does this cause any kind of discomfort? Okay. What about here on your cheeks? And now one of the requests that you had was for a euthanizing type of procedure, and as we age, we tend to get these furrow lines on our forehead, especially when we look up, and we create this crevice here. And one thing that we can do is we can use a filler, and it's really more of just a paralytic combination with collagen, so we'll paralyze the muscles that are in that area and then use a collagen-based filler and insert it into those creases so it'll make it plump up, reduce the wrinkling as well as preventing it from getting any deeper. Now the crow's feet is a little more difficult to tackle because it can happen for a couple of different reasons. For one, the skin is very delicate and thin there. It's some of the thinnest skin on our body. So when we smile and we form that crease, we really don't want to take away from that skin. We don't want to reduce anything, but there's a couple of different things that we can do. Some of them are more of a topical treatment, and some of them are more of a surgical procedure. Generally, I recommend the topical treatments first. You've tried some? Okay. Well, the other options would be something that's surgical. I would still recommend using it in combination with the topical, but we can make a small incision into the hairline and then pull the skin up and tighten it. And what this also can do is it will lift the tail of the eyebrow up, so any kind of hooding or skin that might be sagging or on the top of the eyelid will also be elevated, and the skin will be pulled a little bit more taut. So when you smile, those crow's feet can both be stretched, lifted, but they won't crease as much. Okay. If it's okay for you, is it alright that I can make some lines on your skin where I would make some recommendations, and then you can have a day to consider it, and then whatever your decision is, we can proceed from there. Okay. So to first make a recommendation, I would use a filler in these lines in the forehead. So smooth them out, plump them up, and just make some very tiny little incisions right here. Or I'm sorry, not incisions, injections. To plump up right here. here, here, and then here, here, and here. And that will plump up and also paralyze. And then 2 small injections right here and right here. And that will paralyze the muscle that normally makes that indentation right here. Okay. Very similar. Your laugh lines right here and right here. So when you smile and you get these creases that tend to get really deep, kind of stinks that joy and smiling is something that comes with a consequence. But if we were to do that right there, fill them out, paralyze them, but maybe not as severely as the furrow, and that will allow it to plump up, but also to paralyze it, so that in the future it can be a little more subtle. Now with the forehead, we can also go a little bit more dramatically with something surgical if the topical treatments don't work. Just giving you some options, but we would make an incision in the hairline and then go in from the underside, separate some of the vascular connections, so veins, things like that, separate them from the skin, pull up, and then suture into the hairline. But the sutures and the scarring would happen within the hair, so it's not something that you'll be able to see unless you are very particular in looking for it. But very similar to the eyes, if we do this with the forehead, it will go from the underside and lift up. So topical treatments are very effective by doing this. You'll also stretch out those wrinkles, and combined with the topical treatment. Okay. And I think one of the main focuses, more importantly than the aesthetics, would be the freckles. Because sometimes those can be a concern. It's more so that we want to make sure if there is something that is developing or growing at an abnormal rate, things like sun exposure, chemical exposure, we want to make sure that those aren't causing any longer term problems. Okay. What I'd probably start with is shaving off some of the skin right here on the nose. Not enough that it's going to develop scarring, because if you have freckles along this area right here, and also along the cheekbones, these are the high points, and they look like they could probably get the most sun. Okay. Is it okay if I take a scalpel and I just shave a little bit off? I want to see what the skin looks like once it's been really well exfoliated. Okay. I'm going to just use a little bit of antiseptic here. Just to clear the skin. And also here on your cheekbones. I can feel that these are slightly elevated, so it might not be a bad idea to see if we can remove them. One of the other things that we can do with topical treatments is to use a laser treatment on them. So remove the ones that are larger and then use a laser, something that would be a little bit more or less invasive. Okay. Alright, so if it's okay with you, I'm just going to shave the top part of the skin off of your nose here. And also your cheekbones, if you don't mind. nice and taut, but I am concerned that they're a little bit elevated. Okay. Alrighty. Let's go ahead and just wash that off there. Yeah, it's not enough to make any kind of discoloration or irritation, so that's good. Well, I'd like you to take some time to consider some of the options. We can start with something that's a topical treatment and see how well you respond to it, or if you would like to schedule in a time for a procedure, we'd be more than happy to do that as well. So I'll hand you a mirror and we can take a look at where these marks are to do the injections, or if you'd like to do the surgical route. So I'm just going to mark inside your hairline right here. Okay, that's where I would make the incision over there. And then it looks like over there. And with the top here into the hairline, I'd probably make 3 incisions, one right here on the side, towards the center, and then the other side, right there. So, taking a mirror here, I want you to just take a look at where these marks are, and you tell me if these areas are discrete enough. Okay. Take some time to think about it. These are never rushed decisions, and although I usually would recommend starting with a topical treatment, I know that that option is not always the desired one. Yep. I'm fully supportive of anyone who wants to make changes to their body. Just be well aware of the side effects, the outcomes, what to expect. If we were to go with a topical based treatment and injections, the recovery time is usually a day. The swelling will go down, you'll have some puffiness in some areas such as around the eyes, you might have some slight discoloration. With the injections along the forehead, it pretty much dissipates within a day. The puncture site is negligible, and the swelling will disappear very, very quickly, but the paralytic will be very effective quickly. Same with the smile lines. With the surgical options, the recovery is quite a bit more. I would require anesthesia. You'll go under and put a couple of sutures into the hairline. It's not recommended that you use any chemical-based shampoos for probably 3 to 4 days afterwards. Swelling and bruising is very common, as well as making sure that the incision sites are very clean. A little bit more of a recovery pace, but the results are also permanent, or much longer lasting. Okay. Well, I will leave you to your thoughts, and if you need more time to consider, that is perfectly welcome, if not encouraged. These are big decisions. Alrighty. Thank you very much, and I will see you in a little bit.